lower respiratory tract disease is a really common problem. It's actually the most common infectious disease worldwide. We can't plan healthcare properly if we don't know how much disease there is. What we do in AvonCAP is look at all the cases of community-acquired pneumonia, lower respiratory tract disease in adults who are hospitalised within the Greater Bristol area.
The AvonCAP study is a traditional surveillance study, which is sort of epidemiology bread and butter. AvonCAP is an excellent example of a great collaboration between quantitative researchers and clinicians.
Including both acute care hospitals in Bristol enables us to be comprehensive with this data set.
It's incredibly comprehensive, much better than national level studies. We collect detailed information about every single patient.
Most studies that do surveillance work on a basis of clinical coding data. Diagnoses the hospital have recorded based on clinical use rather than for research. They have millions of patients' data, but we know that it's not comprehensive and we know that it has an error rate.
The national level studies don't have as detailed information about demographics, income distributions, underlying conditions, so they can't do the level of description that we can do in the AvonCAP study.
We take an entirely different approach in the AvonCAP hospital system. In the morning, the clinical research team will screen the hospital admission lists. Every patient's details are checked for signs and symptoms, and then the nurses will go and physically check the electronic or paper records of all of those possible cases to decide who does and does not have acute lower respiratory tract disease. They're also the people who interface with our patients, and it's really important that the research is done within an ethical and legal framework. Something like 70 to 80% of people do give us consent, but that doesn't capture everybody. If, despite all of our efforts, we simply cannot contact that person, then we include them in the study under the appropriate legal permission that we have.
Because we're collecting all this detailed information with the same nurses and the same setup, we've got confidence that the data that's coming in is consistent across time and we can make sense of it.
We take the data that we collect from the hospitals in AvonCAP and we combine that with data that we get from other existing data sets.
The comprehensive surveillance that we've got in the hospital and an understanding of the underlying population of Bristol leads to really quite interesting population level insights. We can extrapolate to the entire population of the UK. And in some of our study designs, we can extrapolate to the rest of the world. But like all studies, it's imperfect. We understand where the imperfections lie and incorporate them into estimates of uncertainty around our results.
The evidence and the analyses that we produce from Bristol lets us answer some of the key questions that are being asked in the public health domain.
The best example that we've got of that is the vaccine effectiveness studies that we've done on COVID. These estimates are used in policy advice, not just nationally, but internationally.
So AvonCAP has been remarkably successful because it is a collaboration bringing together healthcare and academia, working across that interface to make meaningful change.